Welcome to this podcast on Ascites. We're going to be discussing the radiographic features of ascites with respect to plain film, ultrasound, and CT scan. We'll begin with the plain film findings. It's important to realize that plain films are neither sensitive or specific in detection of ascites, and that approximately 500 milliliters of fluid is required for ascites to be depicted on plain film radiographs. Essentially, what you're looking for is a featureless abdomen, which is kind of like a generalized graying out of abdominal structures. You get a loss of the normal organ outlines, such as the liver, spleen, psoas musculature, and kidneys. You'll be getting central displacement of large bowel loops. You can see increased separation of small bowel loops, thickening of the peritoneal flank stripe, and bulging flanks. So here's a CT image which hopefully will make some of these plain film findings a little bit more clear. You see labeled the fluid which is on both sides of the abdomen. There's a large amount of fluid and it's pushing on these loops of bowel. I've labeled a loop of contrast-filled large bowel, and you can see that it's centrally displaced towards the middle of the abdomen. Normally large bowel is located much more peripherally, and you can imagine that multiple loops of small bowel with fluid in between them tend to float upon this fluid and can become separated from one another, and that's evident on the plain film as a separation of small bowel loops. So here's an example of a plain film radiograph in a patient with ascites. You see some of the things we were talking about. You get centralization of the large bowel loops, separation of small bowel loops, loss of the normal organ outlines, and a generalized featureless abdomen. Here's another more striking example with bulging flanks, a featureless abdomen, a generalized graying out appearance of the abdomen, and significant centralization of all the bowel loops. Here's another example from a Scout CT scan. You get a supine and a lateral view here, and it's more of the same. So you get a generalized featureless abdomen with central displacement of bowel loops and bulging flanks. So now we'll move on to the ultrasound findings. Ultrasound is much more sensitive at detection of ascites and can pick up volumes as small as 5 to 10 milliliters. Free intraperitoneal fluid tends to flow along the peritoneal reflections, and we can use this to our advantage when looking for a small amount of fluid, because fluid tends to accumulate earliest in specific places, such as the hepatorenal recess, known as Morrison's pouch, the pelvic cul-de-sac, the pouch of Douglas, and along the pericolic gutters. The appearance of ascites on ultrasound is anechoic, meaning that it's essentially black, and no echoes, homogeneous, and freely mobile. There are multiple clues that you can see on ultrasound that could suggest that the fluid is not simple ascites and is in fact complicated, such as with infected fluid collection. Some of the things you'll be looking for include internal echoes, meaning that the fluid is not completely anechoic or black, septations, loculations, and clumping or tethering of adjacent bowel loops. So here you have an ultrasound example of ascites. On the picture on the left, you see an image at the level of the liver. So the black stuff that I've labeled with the arrow fluid around the liver is all free fluid ascites. You can actually see on this particular image the liver has a very nodular contour, looks a little bit shrunken, and in fact this is a patient with cirrhosis, which is the cause of the patient's ascites in this particular instance. On the image on the right, you see at the level of the right kidney, again, this large amount of black anechoic fluid anterior to the right kidney, which was ascites. So here's another example with a smaller amount of fluid, and you can see how much more sensitive ultrasound is at depicting small fluids. So in the top left image, it's an image at the level of the liver, and you see to the left of the liver, superiorly, is a small collection of anechoic or black fluid. And on the image on the right, you can see again, anterior to the right kidney, a small amount of anechoic or black fluid. So now I'll move on to the CT appearance of ascites. A couple of things to keep in mind regarding ascites in CT is that you'll get a sparing of the bare area of the liver. The bare area of the liver is the posterior aspect of the right hepatic lobe, which is not covered by peritoneum, and thus the fluid has no way to get to the bare area of the liver. And that's can sometimes be a clue that the fluid is in fact ascites and not pleural effusion. Because you can run into a problem when you see fluid adjacent to the liver and adjacent to the diaphragm and trying to determine if this is in fact ascites or pleural effusion. One of the more sensitive ways to make this determination is the diaphragm sign. This essentially means that if the fluid is posterior to the diaphragm, it's ascites, whereas if the fluid is anterior to the diaphragm, it's more likely pleural effusion. Now, in terms of the earliest locations to see ascites, they're very similar to the ultrasound locations: the Morrison's pouch, the pelvic cul-de-sac, the pouch of Douglas, and the pericolic gutters. The benefit of CT when you're talking about ascites is that you're getting an overall CT scan of the abdomen and pelvis as well, and this could give you a clue as to the etiology of the fluid. You could see, for instance, like we saw in the ultrasound case, a stigmata of cirrhosis, which could be the clue that this ascites is from liver failure, for instance. So here we have multiple CT images in a patient with a large amount of ascites. In the top left image you see, again, just as in that earlier ultrasound image, kind of a shrunken and nodular appearing liver in this patient with cirrhosis, and this large amount of grayish fluid throughout the abdomen. Picture on the right, you see ascites concentrating along the pericolic gutters and between loops of bowel. And the picture on the bottom, I'm showing you fluid within the pelvic cul-de-sac, which is anterior to the rectum, and it's labeled there. Here's another example of CT findings of ascites. Again, the top left image, you see a small amount of fluid along the outside of the liver edge. On the top right image, you have fluid collecting along the flanks, the pericolic gutters, and between loops of bowel. Again, on the bottom left image, you see fluid within the peritoneum surrounding loops of bowel. And on the bottom right image, you're seeing, again, fluid within the pelvic cul-de-sac anterior to the rectum. It's to be noted that that larger fluid collection, even more anteriorly at the top of the image on the bottom right, is the bladder. This concludes the podcast on ascites.